Hi, Shaun. It was great to have met you during last week's first virtual IMRB conference. We appreciate that you are willing to share your thoughts to some topics that are hopefully of relevance to the whole mining community. Before we start with the questions, please give a short introduction of yourself and your role.
Hi, my name's Shaun Dando. I'm currently a volunteer team member for the Queensland Mining Rescue Service. I've been a Mines Rescue team member for 25 years, and I work on represent the team members in Queensland on the board of directors, a role which I've held for the last 11 years. I worked in the coal mining industry starting in New Zealand in 1982, and then moved to Queensland in 1999, where I'm currently based, working for the Anglo-American's Grosvenor mine as a ERZ controller and mine deputy.
Okay, thank you. Do you see an increase of awareness and the associated risks to health and well-being within mine rescue teams?
Yes, I think from a Queensland perspective, the COVID situation has driven a large change in how we do things with our assembling our equipment to try and minimise the risk of contamination. So that's been a focus in the last, since the pandemic started. That's been well received. We've changed the way we assemble. Well, we'll assemble our own suits now, our BG4, before we commence training, and then they're stripped and disinfected afterwards. So that's been one thing. Another thing that we've done is VOCs and PAHs, which are like carcinogens on re-entry into coal mines. That's something that we had a recent fire in the last couple of years where we we were aware of that potential hazard to our team members. So there was a significant amount of work done with being able to use equipment such as, I know the Dräger expert was used to give us some indications of whether there was an environment that might be unsafe, and we could do additional swabs or additional analysis. So,
okay, and do you face issues implementing rules and regulations, and if so, what would they be?
I think from the COVID and the disinfectant side of our equipment, the VG4s and that equipment, that has been well received by the guys. The Mines Rescue Service risk assessed and looked at the processes we needed to do that safely, and used the information that was available by the health services and by the equipment manufacturers such as Dräger to come up with best practice solutions for that. So the team members themselves have been trained in Queensland to understand the new process, and that's been well received, I guess, and we haven't had too many issues with bringing those rules into the way we operate as a Mines Rescue Service. So from a team member's perspective, I think it's just mainly ensuring that we communicate. If we do change something, that is again communicated and we understand the reasons for that. So that's updated on a regular basis through our training programs. So I think generally we've managed that fairly well.
Okay, but are the teams expressing any concerns?
With regards to the disinfectant side with the COVID stuff, not really. That's been, like I said, I think well managed. From the VOCs and PAHs, that side of the exposure to carcinogens and whatever, there's definitely been a lot of questions around that, because it wasn't something that was, I guess, on the radar a few years ago.
Okay, that already goes into my next question. Do you see the need for more in-depth training for these topics?
Look, absolutely for the VOC PAH side of things. I think one of the mines I've worked at, we developed or utilised safe work instructions and procedures through the equipment manufacturers and the information that was available, to develop standardised procedures. So that that does need to be embedded into everyone's training regime. So that'll be the way forward, making sure that is best practice, continue to monitor, and as we learn more, then adjust accordingly. But I think any of the health type, we keep a close eye on what else is trying to happen around the world as well, and then that can be with, you've got volunteer firefighters and people that are, professionals that have got exposure to different health issues that we need to be abreast of. There's been a lot of stuff done with AFFF foams and the potential to, need to change products and to ensure that the safety of our people. So that's an ongoing monitoring process, and as an organisation, we try to keep abreast of that.
And maybe you can give us some insight into the training itself. How should these trainings be conducted? What experiences have you made? And what does work and what does not?
I'm talking from the underground perspective for our team members. We train 2 monthly. Our training officers or our trainers are trained multiple times. They train multiple teams. So in Queensland, we have somewhere between 380 to 400 underground team members that get trained every 2 months. So the development by our Queensland Mines Rescue staff of new procedures and whatever is communicated to the trainers, and then the trainers pass that information on to the team members during the trainings. And then, so we'll have 6 trainings a year, and that'll be reinforced through the trainings that we do. So with the COVID, the disinfectant and the way we changed the assembly of our equipment and our stripping processes, that's been communicated and implemented as an ongoing basis, and we continue to do that. So that's worked pretty good. The VOCs, PAHs, then the training, I think, needs to be some of the mine rescue teams that use that equipment and processes. They did specific training, did some practice runs to make sure they were familiar with what they needed to do and the information. So that was a bit more targeted. So going forward, hopefully that information and the processes those teams went through will be embedded to all of our team members as part of our yearly or 2-yearly cycle.
Well, Shaun, thanks again. I mean, you've been very open with your answers, and thanks for giving us an insight into how you guys work in Queensland. And I wish you all good luck, stay healthy and safe, and hope to see you soon. Thanks.
Okay, great. Thanks, Axel.